You what you're reflecting on today on this first Truth and Reconciliation Day as the first president-elect of the Canadian Medical Association who is Indigenous. What are some of those big things going through your mind?
Mm-hmm. I think that we've definitely shifted forward in the conversation about truth and reconciliation. Whether or not we've had the impact that we wanted, I think can be questioned, but we've definitely shifted from the initial Truth and Reconciliation Commission where people were questioning whether or not this even happened to, a normalization that this is a part of our history. And now to this point where we've talked a lot about what we want to do, but are only starting to do it right now. And so as the incoming president of, the Canadian Medical Association next summer and the president-elect this year, today is really meaningful to me because I look around and I see other colleagues who've moved forward in their own leadership journeys and trying to make impact for, the places that we came from and the people that we love and, our own families in a healthcare system that at times can be very hostile and not helpful in the way that, your average Canadian would expect to experience. And really seeing that there's finally a space now where we can have not just our voices heard, but all the voices that we bring into the spaces that we now sit in.
Mm-hmm. And I mean, for you, your personal journey of getting here, you had your own roadblocks, you faced your own discrimination. Can you talk a little bit more about that?
Mm-hmm. So when I was in elementary school, I was labeled with a learning disability. Looking back, racialization probably played a part in them communicating with my parents that I wouldn't graduate high school. My parents obviously worked hard with me to work past that barrier, but along the way, you start to realize that, your experiences are very different than other people's moving into the same spaces, and you learn how to act and how to talk. And along the way, you realize that the systems aren't really set up for you. Now, we're finally in a space where we can acknowledge that. Talking about racism isn't something that I could have said out loud, 10 years ago. And so we should be proud of that as a society and as a nation, but especially on this day when we reflect on the experiences of those who went through residential schools and, the other tools of colonization like Indian hospitals and the 60 scoop and, the justice system. Really sitting back and realizing that we have a long ways to go, but we're at least moving in that direction. I mean, that gives me a lot of hope.
Mm-hmm. Now, you are an anesthesiologist in Grand Prairie, the hospital there. We've been hearing a lot as Albertans about how the North Zone is facing healthcare shortages and there's an overwhelming of the system. But you say that this isn't really that new, a shortage of healthcare for Indigenous communities. Can you talk a bit about that?
Mm-hmm. So within Indigenous communities, there were decisions made historically where we just chose not to create health infrastructure in a place where Indigenous peoples could easily and readily access it. And so that's had long-term consequences on those communities. If you don't have access to a physician or a nurse or other healthcare provider, if when you have some sort of medical emergency, you're not able to get ready access to that sort of care, if you need to leave your community to get treatment for even common chronic diseases like diabetes or pregnancy or things like that, right? It brings a lot of challenges. And then there's also the historical things that happened. I mean, Indian hospitals will be something that I think Canadians will learn more and more about as we move forward. One of the busiest Indian hospitals historically was just inside Edmonton, like Camswell Hospital, and persons from, Nunavut and other parts of the country were, transported thousands of miles away to receive treatment where sometimes they were admitted to hospital for years, away from their family in a place that didn't speak their language, that didn't respect their culture. Patients have different stories that they share in the same way that they shared about residential schools of, horrific things that happened to them. One of the stories that really struck me that came out of southern BC near Nanaimo was, kids who were tied to beds nearly 24 hours a day not just for a short period of time, but for almost 10 years. This is their memory of what happened. And I think reconciling all of that in the context of, what we're going on right now, we've learned certain lessons from Truth and Reconciliation that we can apply to what's going on right now to all of us. What has the pandemic taught us? It's taught us that the truth matters. It's taught us that if words don't lead to action, we never solve problems. And it's also taught us that sometimes government doesn't protect us, so we have to protect each other. And I think that those underlying messages and the experience of going through similar types of oppression and, disempowerment, although it's smaller and, not as big as what Indigenous peoples have experienced historically, helps to bring us together, helps us to understand each other.
Mm-hmm. I know in your folio article, you talked a little bit too about how work camps in remote communities can have such different healthcare to the community that's right beside them. Can you talk a little bit more about that?
So we have certain structures within healthcare that obligate us to do certain things. And one of the things that we know is that if we don't create kind of these lower level thresholds for making sure that the health system does at least that, we actually create environments that are unsafe. And so when you look at the rules and policies within Alberta Health Services or for private companies that, are required to set up in the remote Canadian wilderness or, places that are far away from healthcare services, they're required to comply with certain policies and procedures to ensure that people can remain safe. And so you can increasingly see if you look for it, the way that resource development happens versus how we provide healthcare in settings that are geographically very, very close to each other. So you could have a logging camp that has a 24/7 physician or nurse, a complete plan for evacuating people out if they have some sort of medical catastrophe, 24/7 access to resources for medical emergencies and training for local people on how they can help other people in case, there's a little bit of a lag time to get the person who is trained in kind of the medical field to provide care. And then move 5-10 minutes away, and move into a community that doesn't have any of these things, or that we plan around the absence of these things. It's pretty common for us to accept that within communities, a physician will only be available 1 day per week, and the rest of the time there is no medical service. And these are really choices that we make. And I think the pandemic's really taught us that the choices we make have both short and long-term consequences, and the effect of how fast and how much capacity is being demanded because of the surge in acute care has kind of accelerated these lessons in a way that we're learning them in real time. It does matter where we build things. It does matter how we set things up. It does matter what we accept as a lower threshold of care. And if we can take those lessons and apply it to the way that we build infrastructure within Indigenous communities and stop taking the myth that somehow it's not my problem, someone else has to fix it, I think we'll have a better healthcare system that functions more effectively for everybody.
Mm-hmm. So I guess the question lots of Canadians will be thinking is, what's next? What are we going to do to get there, to deal with these problems now that we're talking about them?
So the great thing about setting aside a day for Truth and Reconciliation is you have set aside moments to reflect, places to focus. There's a lot of things that are eating up our attention and priorities these days. And September 30th, I think, is a time for us to sit back and really hear what's really going on. In the same way that we had to be taught about residential schools, and as we were being taught about it, we realized that these are just core education components about Canadian history that we need to learn. I think with inequities with healthcare, we'll eventually reach that point as well. And once we can all start to deal from the same set of facts, we can all start to figure out the same set of solutions. And I think what's next is really realizing that our solutions within healthcare, improved communication, improved trust, making sure that we properly fund the programs and services that we have, that they're thoughtfully distributed in ways that people can access them easily and readily. We'll take those same sort of lessons and apply them within Indigenous communities, because those solutions are the same, although the problems are obviously magnified in ways that are different.
Mm-hmm. And I know when we're talking about people who are looking for solutions, you and your brother created an app, the Safe Spaces app. If you can talk a bit about that, but also about some of the other things you're seeing happening across Canada that are hopeful.
Yeah, there's a lot of things that the Canadian Medical Association is doing over the past year and that we're planning on doing in coming years. There was a $1 million grant that was provided to the Indigenous Physicians Association of Canada to support, mentorship and, expanding their reach to support Indigenous physicians across the country. There's been lots of space in health summits that have been held by the Canadian Medical Association that have focused on Indigenous health and have really amplified Indigenous voices, representation within our patient voice groups, as well as other initiatives that the CMA is developing and working on in the area of inequity and health system design. The CMA through Jewel, one of their subsidiaries, actually helped fund the Safe Space app. And, with that grant, we're able to expand our network in BC and start to develop a network in Ontario. What Safe Spaces does is it takes lived experience and the challenges that come with reporting and often the unsafe practices that exist when you report into the system, the need for patients or providers to put their reputation on the line, to potentially lose access to care because they damage that relationship with the persons that they're receiving care from, or possibly have their employment taken away because you're not reporting things in a way that wherever you work wants you to, and create a space for people to share those experiences and have decision makers hear them in a way that mitigates risk for everybody. And so Safe Space Networks is really about creating relationships. Sometimes in Indigenous communities, we talk about protocols. It's how do we bond people together? There's that common saying that the truth sets us free. But I think when you're talking about truth and reconciliation, the truth actually binds us together. So it's not about just being free. It's about developing relationships with each other and seeing the world the way that it really is so we can solve the problems that we have.
Mm-hmm. Perfect. Is there anything else that you would want Canadians to hear today?
I think the message for Canadians on this day for truth and reconciliation is that as you learn about Indigenous peoples, the real change is going to happen in you. So what you're really doing is learning about yourself. You're learning about what you believe, the ways that you look at things, the ways that you see problems being solved. And as we both change, as the truth comes out and what you believe and how you act changes, that's really going to be the change that we're looking for in Canada. And that's what's going to bring us together.